It can be affected one limb alone, like only one hand or only one leg or the entire one side of the body, or it can be a quadriplegia, which is the all four limbs can be affected. Certain conditions can affect the speech. There can be a condition called dysphagia, that means you cannot swallow anything. This usually happens because of two reasons. One is called an infarct, which is actually because of obstruction of the blood supply to certain parts of the brain. It can be because of a simple clot, or it can be because of an embolic clot, something connected with the cholesterol, high cholesterol and all, and it can obstruct the blood flow to the certain parts of the brain, which is actually giving damage to certain parts of the vital areas of the brain, which is controlling the movements as well as the sensory functions. According to which part is affected, the body will reflect usually the impact. There can be two types. One is because of the obstruction, which is called a infarct. The another one can be because of a hemorrhage, I mean a bleeding into the brain or intracranial cavity. It can be because of high blood pressure, or it can be because of an infection, or it can be because of a trauma. Ayurveda has got very clear ways and means to identify these two parameters. We also at AyurVAID use the modern parameters like a MR angio or a MRI brain, Doppler kind of investigations to analyze what is the cause of this. We have treated immediately after the emergency management, the ICU management, for a faster recovery along side by side with the allopathic fraternity of medicine in bringing back the patient with a very faster recovery, and side by side with the physiotherapy along with the Ayurvedic therapy protocol like the Panchakarma therapy, like little bit of Taila Virajana, Vasti, and where it is applicable we also give a nasal application called a procedure called a Nasya. And all these parameters along with the treatments like Kerala Ayurveda treatments like Pirichil, Navarakiri, all those things are used actually to restore the neuromuscular functions back, and in chronic cases to restore back the neuromuscular degeneration, the muscular degeneration atrophies and disused atrophies because of the chronicity of the problem, bring back the patient to the near normal lifestyle possible, side by side as an integrative approach as well as an independent approach according to the condition the patient approaches. So we have got a very high rate of success in the recovery rate, and the patient has almost recovered 80 to 90% within a very short span of 40 to 60 days of time. So according to the chronicity of the condition, we analyze. For an example, in a hemorrhagic stroke, in an acute condition, the treatments like a Shirodhara or Shirovasti cannot be done because it can cause a vasodilatation, which can again cause a bleeding and a second attack. So in such conditions, we do a very critical analysis, what should be done, what should not be done, and we will be doing all the therapies under the supervision of highly qualified senior medical personnel in the therapy room itself, with a very highly trained nursing staff with a good theoretical and practical knowledge and expertise.